Welcome to the Killer Boobies podcast, unraveling breast implant illness. Here's your hosts, Wendy Bunnell, Leslie Smoot, and Brandy Vega.
I'm thrilled to introduce you to our guest today. This is Marguerite Barnett, and she is a double board certified plastic surgeon, and she works in Sarasota, Florida. She received her medical degree from Harvard Medical School, and she's been in practice for more than 30 years. But she's with us today because she is known as the doctor who specializes in breast implant removal, and she has performed thousands of explants already. So Marguerite, welcome to the show.
Thank you. Sure.
Well, here's the first question I have for you. It seems like you acknowledged pretty early in your career that breast implants for some women posed a problem. And I just wonder, how did that evolve for you? How did you first start recognizing that there were issues?
Well, I trained through the military, which was a great training program, but of course I did a lot of firsts, some of the first female to be in the training program. And one advantage or disadvantage is sometimes your colleagues think that you have magical powers with women. So I tended to get what I called, they'd say, we have a difficult patient, which was usually a code word for a woman who was upset about something, and they somehow felt that I could magically soothe the woman. So they told me they had a young lady who was convinced her implants were making her ill, but they couldn't find anything, and could I please talk sense into her? So she came into my office, and this was probably in the late 80s, and her history was she was young, healthy, active duty female, and had received implants, I can't remember how many years before, they were the gel kind, and was doing good until she developed some contracture. Now in those days, we would try to break up the hardness by squeezing the breast. I wasn't any good at it because my hands are small and very flexible, but the guys would pop these capsules in the office. So she said, they popped it, and I went home that night and I came down with what felt like the flu, and it had never gone away. This was 2 years before. So she went back to them. She said, something's not right. I'm sick, and it happened after you popped this implant. Could it be the implant making me sick? Well, we didn't have a lot of tests back in the late 80s. I don't think we had the MRI yet. We had CAT scan, and we had ultrasound and x-rays, and they did mammograms and everything. They couldn't find anything. They did blood tests on her. Nothing was coming up abnormal, but she was disabled enough that they were going to medically board her out of the military. And this was a process that took several weeks. So she had been bothering my colleagues saying, I'm convinced it's the implants. You must remove them. And they looked good, and they were now soft. So the guys didn't want to do it. So she came into my office with a stack of papers about this thick. And remember, we didn't have the internet so easily then to Google everything, but she had gone to the library while she was ill, and she had researched everything she could find about breast implants and illness. And she came in with a lot of scientific papers, and I was embarrassed to realize that even though I'm supposed to be an expert on implants, many of these papers I had not seen. There were some papers in which they had injected silicone into mice, and they would develop this very crippling kind of arthritis. Their little fat pads on their paws would dissolve, and they hobbled around like they were crippled. And she said, this is how I feel. I wake up in the morning, I can't even put my feet onto the ground. I feel 90 years old, and x-rays aren't showing anything with my feet. But she says, could it be something like this? And I said, hey, honey, I don't know. Smarter guys than me are saying these implants are safe, but it seems to me if you have something put in you for no reason other than you want to go up a bra size, then it should be your right to have them out for any reason you want. Mm-hmm. So I agreed to remove them, and we found that one was ruptured on the right side, which was where she was having the most trouble. It had not shown up on any of the films. And She did get better, not enough to avoid being boarded out of the military, but she did get better. And so that was probably the first patient I began to think about. And the other patients I had seen without recognizing. For example, many of the servicemen would marry these Asian women when they were stationed in Asia. And a lot of the women had received silicone injections. They heard that the American men like women with bigger breasts, and most of the Asian women didn't have giant breasts, so they had silicone injections. And they would come to our clinic sometimes years later. It would work for a year or two, but then what would happen, the body would react to this silicone and form these terrible lumps. It was like cancer, you know, the whole breast would be full of these lumps. Sometimes they would open up and drain out. And so it was a big problem. We would have to do like mastectomies on these poor women to clean out all this silicone. And I realized that they were having a lot of these symptoms that this other woman was complaining about. Now, when I went and talked to my professors about that, they said, oh yeah, but that's because we don't know what was injected into them. It probably wasn't pure silicone, it was industrial, it was mixed with things that are making women sick, so it can't be the silicone, it's something else. You know, I was a lot stupider back then. I didn't question authorities so much. Now I'm getting older and really mean, and I'm always questioning everything. But I thought, oh yeah, that must be it. It's not pure silicone. But after this patient, I thought, well, you know, this was pure medical grade silicone. And she had all these same symptoms the women did, enough that it disabled her. And that to me was disturbing. So I kept my eyes open after that. And it was amazing to me how many women I started running to, especially in the 90s, because remember the FDA put a moratorium on the gel implants. And so suddenly this was in the news and everybody was very upset, and many ill women were coming out of the woodwork. And at the time, it was hard for women to find surgeons that would treat them. And that was a problem with the litigation in the states of Texas and Connecticut. The lawyers, for some reason, were suing the surgeons that put them in. And so I think all of us were nervous that we were suddenly going to be swept up in a bunch of lawsuits. Many surgeons were like, you know, wouldn't touch the ladies with a 10-foot pole. And I think one reason that the women came to me was they felt as a female I would be more open-minded and less, and they were right. You know, I was raised by a minister. He taught us you should do the right thing, even if it's not necessarily advantageous for you. You have to do the right things. I was seeing these patients, even if there was chance I could be dragged into lawsuits. And I saw so many of the women become better that I said, this can't be in their head like the guys are saying. And so here we are many years later.
Well, yeah, that's exactly it. People still use that comment that it's a big frenzy and people are getting all excited and removing their breast implants unnecessarily. But I know that in the breast implant illness groups, we have seen person after person after person get better. And I know in my own case, I'm one of those women who had all sorts of autoimmune problems. I'm 6 months out now, and my health is remarkably better. Like, there's no doubt in my mind. And now that you've done thousands of cases, do you feel the same way?
Oh, yes. In fact, I've told my patients, you know, honey, I'm a woman, and if you don't get better and you just hate how you look, come back to me. I'll put the implants back in at a greatly reduced price. And do you know, I can only think of 3 people out of 3,000 that took me up, and 2 of them told me that was a mistake. They want back out again.
Wow.
So, yeah, I had one other girl. She said would come in every year for a while and talk to me about it, but she said, I don't dare I said, why don't you just let me do it? She said, my husband, every time I talks about it, he grabs my hand, he takes me over to the filing cabinet. I guess he was in charge of filing all the bills. So the year before she had them out, their medical bill folder was like 6 inches wide. And then the year after, it was like, only less than an inch wide. So he says, don't you dare do that. Look at this. And each year it had stayed very thin compared to the year before. So,
oh gosh, honestly, that is the truth. That's what ends up happening is people start to get the symptoms and then they start trying lots of different doctors to figure out what these problems are all about. And then pretty soon you're spending an outrageous amount of money trying to chase your health back down. When people come to you to get breast implant removal, what kind of symptoms are they complaining about or demonstrating?
Well, it runs the gamut, but I would say the most common ones are being achy and tired, the brain fog, changes in the bowel, like irritable bowel, irritable bladder, weird rashes, hair falling out, dry eyes, dizziness. There's just so many of them. And I think that's one reason why it's hard for the surgeons to accept that this is happening, because they say, oh, look at all these different symptoms. How can one device affect so many different systems in the body? I think it's entirely plausible, and I don't think it's in the ladies' heads. And
the things that you just listed are things that so many of the women have. And they honestly might have 8 out of 10 of those symptoms. I know in my case, what you just listed, I'm sure I had at least 8 of those. And then other problems too. I think I was diagnosed with Lyme disease and Epstein-Barr virus and vertigo. And the list just went on, and it was confusing because of all those problems were systemic.
Yeah.
And it was confusing because they would say, well, your body's attacking you and it's an autoimmune problem. But I kept thinking, why? Why is my body attacking me?
Well, first of all, any foreign body that you put in, you're going to have some kind of reaction. That's what your immune system is designed for, to protect you against something that is not you. Mm-hmm. So every day we don't think about it, but we're exposed to germs and bacteria, viruses, and toxins. If you eat a food that's not good, and because our systems take care of it, and we don't notice it, but this is a process that's always going on. So now you throw in this big bag of chemicals and you're putting it into an area that has a lot of lymphatics and blood flow. To me, the wonder is that more people don't get these symptoms. The body's going to react in some way.
What about you? Are you following up with your patients to find out their health recovery after the explant removal?
Yes. For some symptoms, like what I call local regional things like pain and inflammation in the chest, and this extends even to things like neutral headaches, the restricted breathing feeling, the pain in the middle of the back, shoulder issues, tightness, that kind of stuff, 98% of the time that resolves once women get the implants out. For other things like being achy and tired and the brain fog, 2 out of 3 of the women appear to be getting better. Mm-hmm. So,
in a matter of time, do you think, is it in time? Like, let's say if they're a couple of years out or 5 years out from the surgery, do they slowly start to get better and better?
Well, that's why I don't think it's a placebo effect. A lot of my colleagues say, oh, this is placebo, because if you're tired and achy and somebody gives you a sugar pill, even if you know it's a sugar pill, your mind is so powerful that many times people react positively to it. And the more expensive the pill or the intervention is, the more drastic it is, often the bigger the effect. But placebo effects are typically like 1 out of 3. And generally is highest right after the intervention. And then as time goes on, seems to wear off. But we're finding that for many of the women, the farther out you go, the better people get. I ran into one lady in Publix not too long ago, and she was like, Dr. Barnett, oh. I said, you don't remember me? She said, you took my implants out. You told me it would be 4 years before I got better, and I just wanted you to know you were right. I was like, oh, that's good. I said, are you 25, 50, 75% better? She said, I'm 100% better. So whoever she was, I didn't get her name. It took her 4 years. So, I don't know what the limit is. I've been trying to follow my patients at least 2 years, but evidently maybe even longer.
Mm-hmm. Mm-hmm. Yeah, well, I think it is pretty positive, the outcomes that women are having, that they're recovering fairly quickly. And that's good news. That's really nice. Why don't we talk about some of the risks with the plastic surgery of the explant procedure?
The major risk is whether you're in good enough shape to withstand anesthesia. And it takes a little longer than putting them in because the capsule is part of you. So we do have to peel it off of the ribs and the muscle, whether it's under the muscle, on top of the muscle. As I said, for me, the hard ones on top of the muscle are the easiest. Hard ones under the muscle are the next easiest. The softer ones are harder to do. And under the muscle is harder, but it's usually not any more sore. So that's a good thing. Most people, when you put them under the muscle, it's very painful because of the stretching and cutting of the muscle. And when we take the capsules out, we're not really taking anything new out. So you don't have that stretch, so it's not so painful. But besides the risk of anesthetic, and I really think as long as your heart, lungs, and your kidneys and liver are in decent shape, you should do fine. You have more risk driving around in your car, as long as you have good anesthesia providers. This isn't something I want to try in the office under local. No, it's hard. The other risk, of course, would be bleeding. So people who are on blood thinners are at much higher risk because the breasts have good blood flow. So hematomas are not uncommon. Infection is less rare unless you're smoking or diabetic, but even those things are not absolute contraindications. If you're not careful, you could damage things like nerves to the muscle or even get into the lung cavity and cause a pneumothorax. Again, with careful surgeons, that should be extremely rare, should not cause big issues at all. So, but every patient is different. And the old liquid gels from the 80s, those make me very nervous taking out because that stuff can spread and eat into tissues and I can get into things quickly. The newer cohesive gels are not so bad. The salines make very thin capsules, so they can be challenging getting the thin ones out, but it's not impossible.
Mm-hmm. I've seen on some breast explant videos that some of these implants come out and they're sticky. They're very tacky on the outside. What's going on in that case?
Well, that's a thing called gel bleed. Mm-hmm. And many people don't realize even if the implant doesn't rupture, that gel stuff can leach out through the envelope. I had a photo somewhere and someone ran off with it. I put one of the gel implants down on the white exam paper overnight. I flipped it over the next day. You could see a little oily ring where it was sitting.
Oh, wow.
So people don't realize that this process starts from the day they put them in you. Now, it was worse than the old ones in the 70s. The company would actually, the representatives wrote the companies and said, these are so sticky, we have to take them into the bathroom before we show them to the surgeon to wipe them off because they're so nasty. So fix this if you could. So the company realized, oh, this isn't good. And it was more that they couldn't sell it, not that they were worrying about the stickiness going into the patients. So then they devised some barriers inside the envelope to coat it so it made it less permeable to the gel. But the barriers, from what I could find out, were sometimes like things like fluorosiloxane mixtures. And fluoride was quite toxic. I remember reading a tanker went over outside of Houston and had to send the hazmat crew in to clean it up. So if that's the same fluorosiloxane they were using in the implants, that wasn't probably a very smart idea to put it in to people's bodies inside the device and expect it to stay there for years. So a lot of the stuff is proprietary, meaning they don't admit to what they did, but somehow they made it a little less leaky, but it's not 100%. And nothing is, if you have one of those good freezer baggies and you put some raw fish in it, it can hold water nicely, but after a few days you begin to smell that raw fish smell coming through. So little molecules are coming out. So there's nothing that we have that's totally impermeable. So I don't think we should be surprised that these things are sticky when they come out.
Right. Yeah, it makes me think twice, of course, after having this experience about anything that's going to go into my body. I've been extra paranoid. I'm even talking about topically, like I'm just really wondering anything that's absorbed into my body, what do I really want it in my body?
They said since the Industrial Revolution, which was, towards the end of the 1800s, so it's only been, 150 years or something, more chemicals have been produced and turned loose in our environment than we ever were experiencing prior to that for millennia. So all these things were produced and put out without consideration of what are the long-term effects. I have a feeling our descendants will be, what the hell were these people thinking? What were they doing,
Yeah, we got so excited about moving forward. We forgot to ask questions about what we were doing. Yeah. Well, I just want one more question from you. And I thought, could you speak to some of the ladies that have had implants put in 20 plus years ago, and they've never thought to have them exchanged or removed? Do you think there's any concern for the people that have had them for a long time?
Differs depending on whether they are gel or salines. The gels are more likely to rupture and you don't know about it. If the saline leaks, you know about it because your body pees out the salt water. You'll go flat, and that shouldn't harm you because we're pretty much 75% water. But the gel, if that leaks, you don't always know about it till it gets into a problem. And although they claim that the new cohesive gels are, safe because you can cut them and it doesn't go anywhere, we have gone in on some of these ruptured newer generation implants and found them to be quite messy and much more liquid than you would expect. So I think the body is able to break down some of these cohesive bonds with time, temperature, I don't know. So if you have the gels, then you definitely need to think about it,
Is it fair to say that the longer they keep the implants in, the greater the risk for complications?
Well, certainly the higher the rate of rupture after about 12, 13 years. And it's the same principle that you're not supposed to use Vaseline with a condom. You know that, right? Do you know why?
No,
it's because the Vaseline is petroleum jelly and a condom is latex rubber. So when petroleum comes out of the ground, it's a liquid, almost a vapor. So the way the chemists describe it is they polymerize those molecules, meaning they make cross-links between the petroleum molecules, and the more cross-linked it is, the more solid it becomes. So you cross-link it a certain amount, you have the jelly. If you cross-link it more, you get the rubber. You cross-link it more, it becomes hard like plastic. Same thing with silicone. But they say one easy way to break down the cross-linkage is to submerge the rubber or the plastic in the liquid or the gel. So it was a design flaw to fill silicone rubber envelopes with silicone gel. it dissolves the bonds.
Especially over time. Yeah.
Yeah.
And you also mentioned the body temperature.
So I'm not too worried about the temperature. It's just the time element being exposed to the gel, so it breaks down. And then you have a rupture. And again, if the body then is able to disperse the smaller gel molecules or break down the small gel molecules into even smaller ones, the smaller the molecule, the farther it can travel. And in general, the smaller molecules are more biologically active in the body. That's something we're taught when we're learning about device manufacturing. So there's a lot of unknowns, but generally with the gel, there's good reason why you want to change that out. Mm-hmm. Certainly if you're having a problem, it's not worth keeping them. But if you have the salines, no trouble, probably okay. I don't think you have to necessarily change them out. The gels, yes.
Yeah, great. All right, well, do you have any other words of advice you would want to give anyone who's thinking about having their implants removed because they're not feeling well? Just, do you have a message for them?
That's one thing that's very good about the group. You can listen to so many other people's experiences and see what it's like. Am I ill, or is just normal aches and pains of getting old? And then sit with your intuition. I think so many women say, I knew this for a long time in some part of my brain or my gut, and I just have been ignoring it because I didn't want to think about it. So think what do you feel deep inside of you, and don't let people scare you or talk you into this or that. Be informed, be more informed about the removal than you were about placing them, and you'll do fine.
Excellent advice. Yep, that is excellent advice. Well, we really appreciate you joining us today and helping women understand breast implant illness and answering some of the questions about removal. So we hope you have a wonderful day.
Thank you, and you too.
Thank you for listening. Spread the word by subscribing, liking, and sharing the Killer Boobies podcast today. You could be the person who helps someone reverse their pain and suffering and reclaim their health today.